Going on, everybody? This is Group 6, consisting of Aisha Diallo, Darvez Ellis, Morgan Mashburn, and Rashmi Patwarden. And for this project presentation, we focused on the impacts of COVID-19 on the healthcare industry. So let's start off with before COVID. Before the COVID-19 pandemic, the healthcare industry was one that seemed to be rapidly growing. According to the Bureau of Labor Statistics, the healthcare industry has 4 of the 10 highest projected new jobs over the next decade, coming in the forms of home health and personal care aides, registered nurses, medical assistants, and medical and health services managers. This may come as no surprise since there have been signs indicating that there was going to be an increased demand for healthcare workers. Factors such as improved technology, as well as general advancements that humans have made, have placed us in positions to have longer life expectancies than ever before. In addition to the longer life expectancy, citizens over 65 are beginning to make up more and more of the population than in previous years at a faster rate. The healthcare industry has always been a stable field as far as labor demand goes. As the Bureau of Labor Statistics reported that during the Great Recession, healthcare showed a healthy amount of employment growth and has always seen a fall this pattern during previous recessions as well. Keeping up with this high rate of demand seems to be the only real conflict. Going on to some of the main effects of COVID-19, one important effect has been a steady and increasing demand for healthcare workers in the industry, which is pretty much very expected. One statistic, according to the new American Economic Research Fund, is that in March 2020, the number of healthcare jobs posted online on average every day increased by 8.8% over February's average. This is a stark contrast with the total number of all job postings, which dropped by 43% in March alone. Demand for COVID-specific jobs has also increased, with more healthcare workers needed to assist the millions of Americans now infected. This includes positions that require infection control certifications, respiratory therapists, and critical care nurses. Again, whether it is possible to meet this growing demand is the question, with a potential for shortages. Healthcare workers, especially at the beginning of the pandemic, face serious and life-threatening risks by either continuing to work or rejoining the workforce from retirement. Given shortages of PPE and documented emotional and mental distress due to the workplace conditions, labor supply is much harder to bolster.
So I'm going to talk about the short-run effects on labor demand and labor supply. First, I want to point out that during the COVID-19 pandemic, the labor demand and labor supply for healthcare workers has risen as well as decreased in many healthcare fields. The line of healthcare is a wide variety of different occupations, from dentists and at-home care workers to nurses and doctors that work within a hospital. Since healthcare workers are such a wide variety, when looking at the changes in supply and demand for healthcare workers, we must take this into consideration. So talking about the labor demand specifically, over the course of the pandemic, frontline healthcare workers' demand curve has shifted to the right significantly due to the rising number of hospitalizations. Doctors, nurses, and other forms of essential frontline hospital employees have seen an increase in demand while more and more people are being admitted to the hospital due to COVID-19. However, other healthcare workers have seen a drastic drop in demand, like dentists, which have dropped 56%, and other health practitioners' offices, which have dropped 24% from February to April. When employers are looking for new healthcare workers during this pandemic, those who have certain licenses and certifications, such as nurses, respiratory therapists, and those with certifications in infection control, are in much higher demand, whereas pharmacists, medical assistants, and mental health counselors have seen a decrease in demand. So the short-run effects on labor supply. Over the course of the pandemic, there have been a lot of factors that have influenced the supply of healthcare workers. The labor supply for healthcare workers during this pandemic has seen a decrease in the amount of workers that are available to the rising demand. There are several factors that contribute to this. Some of the factors that are affecting the labor supply due to COVID-19 have been things like childcare and the part of the workforce that are at risk. According to recent studies, around 26% of the healthcare workforce have school-aged children at home, and roughly 8.4% are single parents. With the closures of schools and daycares due to COVID-19, as well as the high risk of COVID exposure, which means like babysitters and grandparents are often not an option for childcare, many parents are left with no options other than to take off work and tend to their children. Studies have also shown that approximately 4.6 million healthcare workers fall into the high risk category, either themselves or someone in their home. This means that they have a higher risk of falling ill to COVID-19, and their reaction to this illness could have higher effects on their body. Therefore, many healthcare workers have been unable to return to work or continue to work for theirs and their family's safety. We can also take into account that healthcare workers aren't immune to contracting COVID. Therefore, there are those who are able to work. Some have contracted the viruses themselves, which results in them being out of work until they're cleared. This results in a shortage of healthcare workers available to meet the demand needed. Therefore, the labor supply curve shifts to the left. In the past few months, however, there have been many different factors that are beginning to change, which is returning the supply curve closer to normal or the position it was prior to COVID-19. This can vary from state to state, but many areas across the United States are beginning to reopen, especially schools and daycares, which has relieved some healthcare workers from their parental duties, allowing them to return to their jobs. This has somewhat shifted the supply curve to the right, which helped move it back closer to what it was pre-COVID. Now I'm just going to discuss the graph of the labor demand and labor supply curves. So the graph pretty much just shows how the labor demand curve will shift to the right from D sub 0 to D sub 1. It also shows the labor supply curve will shift to the left from S sub 0 to S sub 1, kind of resulting from, or this represents an increase in wages due to these shifts. It also shows an increase in employment. This, however, we just want to state that it doesn't represent all healthcare workers, but just the doctors and nurses and those working on the front lines of the pandemic, and it doesn't represent all of the healthcare field, considering that each part of the healthcare field would have different demand and supply curves.
So this graph ties together some of the points that both Morgan and Darvez have been making throughout our presentation. So you can see from 1990, the blue line healthcare employment and the pink line all other employment. From 1990 almost all the way to 2020, you can see that healthcare employment has been more steady in comparison to all other employment. And even during Great Recession and other recessions that have happened in the past, healthcare employment has stayed pretty solid and even improved some of the time. You can see that in 2020, while both all other employment and healthcare employment completely tanked at the beginning of the pandemic due to lockdowns, the healthcare employment graph doesn't fall nearly by as much. And you can also see that now, very, very recently, as the country begins to reopen, both healthcare and all other employment has seen small upticks. So looking into the potential long-term impacts of COVID-19, I'm going to talk a little bit about what the evidence shows that some of these impacts might be, and then connect them back to some of the economic concepts that we have been discussing in class. So the first one is this idea of what's going to happen to the wages, and it has to do with the demand and supply of labor. So as we've explained, while the demand has increased out a lot, supply hasn't quite met that demand and has even been falling for a couple of different reasons. So in order for the supply to reach the level of demand, wages need to increase. And this is usually seen in the form of something like hazard pay, which compensates frontline healthcare workers for the higher risk that they take on as a result of continuing to work or returning to work within the pandemic. We also see that employment is likely to remain high within the healthcare industry. So as we move forward and COVID continues, especially if it becomes something seasonal, as some scientists are suggesting, there's going to be a continued need for healthcare workers, and there's always going to be this continued increased demand regardless, because of those reasons we mentioned having to do with increased life expectancy. We also see that potentially in order to bolster the labor supply, that hazard pay as well as better PPE might become the new norm. This has to do again with raising the labor supply, and part of the reason that some healthcare workers were unwilling or unable to work had to do with those poor workplace conditions. Some federal lawmakers are pushing for these types of policies, according to a report by Brookings. Telemedicine is another thing we identified that is likely to have a lasting impact, especially for healthcare workers who aren't directly involved in the pandemic. So, for example, specialists like dermatologists or dentists don't necessarily need to be seeing patients in person right now. And so, telemedicine has helped a lot in that sense. However, it's also going to increase competition in the market for highly specialized healthcare professionals because now you can see a doctor from 100 or 1,000 miles away. And so that might drive wages down, but likely won't affect employment because even if it's a virtual process, you still have to have somebody behind that screen. And so now I'm going to talk regarding these policies and concepts a little bit more about how it relates to what we're learning in labor economics. So this first large concept is that of wage elasticity. And essentially, this has to do with increasing the hazard pay in order to try and increase the supply of healthcare workers so that it can meet the demand. And because of the wage elasticity of labor supply, when wages increase, more people are encouraged to work. But of course, we have the opposing substitution and income effects, where the substitution effect suggests that leisure is more expensive, so people will work more, but also the income effect counters that and says that if you have a higher income, you can afford more leisure. So ideally, a policy like this should be balanced in a way that allows a substitution effect to prevail. Also, in speaking about the different policies that might be enacted, federal lawmakers are trying to consider policies, again, that bolster that labor supply. So increasing the minimum wage for healthcare workers to a living wage, providing paid sick and quarantine leave, and adopting hazard pay. So these kinds of policies may have lasting effects if they become the norm in the industry, especially as this probably isn't the last pandemic that we'll face. So not having that paid sick or quarantine leave is discouraging to workers and can be unsafe. And so that would decrease the labor supply. And finally, the elasticity of substitution is another big concept. So because these healthcare workers, for the most part, such as nurses and doctors, are highly specialized and very skilled, it's almost impossible to replace them with some kind of machine or capital. And so unlike in an industry such as food service, we are not likely to see a lot of employment decreases as a result, and the substitution effect is likely to be pretty small.
So this graph is comparing the amount of health workers a country has per 10,000 people with confirmed COVID-19 deaths per 10,000. From bottom to top, this graph shows the top 10 countries with the highest amount of health workers and the top 10 countries with the lowest amount of health workers. Health workers in this data is defined by doctors and nurses. All the countries in the top 10 from Norway to the United States are high-income countries. Which is important to note because one of the biggest concerns from health experts in the beginning of the pandemic was low-income countries with fewer healthcare workers would bear the biggest burden because they didn't have the same access to healthcare as other countries. But based on the data, we see countries with higher levels of income and increased access to healthcare have more COVID-19 deaths than low-income countries. Specifically in the United States, per 10,000 people, at least 7 are dying from COVID-19. What we're seeing with COVID-19 is that even countries with the most robust healthcare systems, some with universal healthcare like Canada, Denmark, Netherlands, Norway, to name a few, and a country like the United States, which spends the most money on healthcare out of any other country in the world, are seeing more negative impacts of COVID-19 than less robust healthcare systems, despite having more healthcare workers. Years from now, researchers will wonder how this came to be and why the volatility and uncertainty of COVID-19 had impacts on healthcare systems that were built to be effective and efficient. With news and research coming out daily about the COVID-19, a big difference between the beginning of the pandemic and now is that people know more about the virus. With the sources we have gathered, ranging from economic journals, working papers, data, and news, we were able to delve into the economic effects of labor for healthcare workers during COVID-19. Thanks for listening to our presentation.